Hypertension is currently stealing kidneys from people who are not health conscious and sending them to dialysis unit every time. Kindly stay to the end of this video to understand everything about hypertension and its management. This lady ended up in dialysis. She's now a dialysis patient all through her lifetime just because she didn't manage common ordinary hypertension very well. It is common but it's not really ordinary. Now, hypertension simply means increase in BP above 140 after a series of consecutive measurements with sphygmomanometer. The normal BP is between 90/60 to 140/90. So if it is above 140/90 after a series of consecutive measurements, at least 3 times, you say that the patient is hypertensive. At least 3 times. You measure it 3 times consecutively in a week. Now, if your normal BP is 130/60, you start getting, let's say, 140 something, maybe 140/60, you are becoming hypertensive, or above 140/90. Now, the signs and symptoms usually asymptomatic. Some of them include occipital headache at the back of your head, dizziness, tinnitus, you start ringing in your ear, syncope, fatigue, pain in the chest, restlessness. The classifications, we classify it into two broad ways, into two broad categories. One is according to the blood pressure readings. Two is according to the causes. According to the causes, we have primary hypertension and secondary. Primary is idiopathic. Nobody knows the exact cause. It's usually related to genetics, environmental factors, and all of that. Now, for causes, classification according to the risk factors. We have discussed that it is usually idiopathic. Here we have primary and secondary. According to the blood pressure measurement values, we have systolic hypertension, diastolic hypertension, and malignant hypertension or hypertensive crisis. I mentioned two classifications here according to risk factors, primary and secondary, then according to measurement values. Now, the causes of hypertension, the cause of this condition is usually idiopathic. It is usually idiopathic. Nobody knows the exact cause, but causes or risk factors or helping causes include age, obesity, hereditary, kidney diseases. People that have kidney problem, they can come down with hypertension. Emotional problem, emotional distress. That's why you always have to manage your emotion very well, because it is a psychosomatic disorder. And other, we also have other causes or other risk factors. Now, the management of this hypertension include drugs. That's the one doctor will always prescribe. Antihypertensives like alpha blockers, beta blockers. But the one I want to dwell on very, very well now, the one I want you to master very well, is the dietary approach and lifestyle changes. You reduce salt intake, avoid alcohol intake, reduce cholesterol rich food, increase rest and physical activity, increase roughages to help reduce bad cholesterol, avoid caffeinated food. The patient was taking caffeine and still on antihypertensive, but she did not see results because of the fact she's taking caffeine. Avoid high intake of refined sugars. Increase your intake of green vegetables and fruits. Very important. Encourage individuals to always check your blood pressure. Buy your BP apparatus. Always check it. Monitor other heart routine tests. Always take your drugs very, very serious. If you don't take your drugs serious, you are going to come down with complications. If you don't live or if you don't live by all these health advice, if you don't listen to your doctor, you are going to come down with complications like diabetes. You see, you can become diabetic from there. That becomes a problem. Hypertensive nephropathy can affect your kidney. By causing hypertensive nephropathy, from there it can lead to kidney failure. The person will now become a dialysis patient. You now depend on machines all through your lifetime. Hypertensive neuropathy can damage your nerves. The nerves of the body can become damaged for life from there, just because of ordinary hypertension. Stroke, cerebrovascular accident, which is of two types, ischemic and hemorrhagic. In hemorrhagic, there is rupture of arteries in the brain, cerebral arteries. In ischemic, there is an obstruction in the arteries. So it is very, very important that you manage hypertension very well. It can affect the kidney, can affect the heart, it can affect the brain. However, whether high or low blood pressure, what is affected is the heart, the blood, and the heart, the blood and the blood vessels. These three things, these three parameters: the heart, the blood, and the blood vessels. Please kindly subscribe to this channel to get daily health tips and solution in order to stay fit. And also remember that health is wealth. If you do not take care of your health, according to World Health Organization, health is wealth, and it is the greatest wealth. It's only somebody that's alive that can start making money, that can make money. It's only somebody that's alive that can make money.